Hello, dear friends. This is Dr. Sophie Miller, medical specialist in integrative health and wellness. Today, I'm going to share with you information that could literally transform your life and the health of your brain. Have you ever thought that your brain might be silently being robbed at this very moment without you noticing? That's right. And the thief is almost imperceptible. The deficiency of a single vitamin that, after age 60, becomes as essential as oxygen for your brain cells. Imagine waking up every day, feeling that your mind is covered by a dense fog. You forget names of people close to you, lose objects around the house, and sometimes even wonder if you're developing some type of dementia. What if I told you that, in many cases, all of this could be related to vitamin B12 deficiency? Recent studies show that approximately 47% of elderly people suffer from this deficiency without even suspecting it. It's an alarming number that needs our urgent attention. Let's understand better what happens. When we cross the 60-year threshold, our body goes through significant changes, especially in the digestive system. The stomach begins to drastically reduce the production of hydrochloric acid and a protein called intrinsic factor. This protein is absolutely essential for your body to absorb vitamin B12 from the foods you consume. Without this mechanism working properly, you could be eating foods rich in B12 and still developing a serious deficiency. It's like having a leaking fuel tank in your car. No matter how much you fill it up, the engine continues without energy because the fuel is leaking before it can be used. The same happens with your brain when it can't absorb the necessary B12. During my clinical practice, I've seen truly impressive cases. Recently, I treated a 74-year-old lady, Lucy. She came to my office deeply concerned because she was becoming increasingly forgetful and irritable. Her family was considering the possibility that she was developing Alzheimer's, which naturally caused a lot of distress. After a complete evaluation and blood tests, we discovered that her B12 levels were critically low. After just 3 months of taking appropriate supplements, she regained her autonomy, returned to doing Sudoku and cooking with confidence. In her words, "It's as if a curtain had been opened in my mind." Stories like this aren't exceptions. Dr. Richard Martin, a renowned neurologist from the Brain Study Center, shared with me the case of Robert, a retired engineer aged 65. Robert started forgetting appointments, constantly losing his keys, and feeling disoriented. The brain imaging tests were completely normal, but when they tested his B12 levels, they were drastically low, only 170 pg/ml, when the ideal would be above 400. After an adequate supplementation treatment, the transformation was so impressive that his family said Robert had been reborn. The most frightening thing about this whole story is that vitamin B12 deficiency can perfectly mimic the symptoms of dementias like Alzheimer's. And the most shocking fact, thousands of people are incorrectly diagnosed every year when the solution to their cognitive problems could be surprisingly simple. But ultimately, why do so many people over 60 develop this deficiency? Beyond the natural reduction in absorption capacity, there are several complicating factors. Many elderly people reduce their consumption of animal protein due to concerns about cholesterol or following medical advice that, in many cases, is outdated. Others have difficulty chewing or digesting, opting for processed foods that are very poor in essential nutrients. And to make this scenario worse, medications commonly prescribed for this age group can aggravate the problem. Metformin, used by millions of diabetics, and proton pump inhibitors, prescribed for reflux problems and stomach acidity, are known to block even further the absorption of the little B12 these people manage to ingest. It's a perfect storm against brain health. You must be wondering, what are the main sources of vitamin B12 that we should include in our diet? This vitamin is found almost exclusively in foods of animal origin. The absolute champion is chicken heart, followed by mussels, cod, trout, wild anchovy, and lamb meat. We can also find good amounts in fermented foods like natto, kefir, and certain cured cheeses, as well as milk and dairy products, especially fresh cheese, cottage cheese, and semi-cured cheese. Eggs, mainly quail yolks and free-range eggs, and seafood like squid and scallops complete this list of B12-rich foods. Do you already incorporate these foods regularly into your diet? If not, perhaps it's time to rethink your food choices, especially if you're over 60 or have family members in that age range. The science behind this is fascinating. Vitamin B12 plays a crucial role in the synthesis of myelin, the substance that coats and protects neurons, allowing nerve impulses to be transmitted efficiently. It's also essential for the formation of neurotransmitters responsible for communication between brain cells. Without adequate levels of B12, this communication is compromised, leading to the cognitive symptoms I mentioned. Studies conducted by Cambridge University demonstrated that maintaining adequate vitamin B12 levels can reduce the risk of age-associated brain atrophy by up to 35%. This is extraordinary. We're talking about a relatively simple measure that can have a profound impact on quality of life during aging. Now, if you've identified some of the symptoms I mentioned in yourself or a family member, what should you do? The first step is to seek medical guidance and request a blood test to check your vitamin B12 levels. It's important to remember that the reference values of laboratories don't always reflect the optimal level for brain health. While many laboratories consider any value above 200 pc/ml normal, neurologists specializing in cognition recommend maintaining levels above 400 pg/ml to ensure optimal brain health. If a deficiency is diagnosed, your doctor will probably recommend supplementation. Here's precious information that can make all the difference. Not all B12 supplementation is equally effective. The most common form found in pharmacies is cyanocobalamin, which is cheaper but not ideal. For aging brains, methylcobalamin is significantly superior, as it is better absorbed and doesn't need conversion in the body, a process that may be compromised in older people. The results of adequate supplementation can be noticed in a few weeks. My patients frequently report significant improvement in memory in 30 to 45 days, return of mental energy in 2 to 3 weeks, reduction of confusion and irritability, better sleep, and more stable mood. Even more importantly, timely supplementation can prevent irreversible neurological damage. It's fascinating to think that your brain represents just 2% of your body weight, but consumes an impressive 20% of the energy and nutrients you ingest. It deserves special attention, don't you think? Especially considering that it's the organ that holds your precious memories, your personality, everything that you are. Can you imagine the results you could experience with this simple change in your routine? Think about the impact it would have on your life to recover mental clarity, sharp memory, and the energy you had years ago. Think about the difference it would make for your family to see you more present, more engaged, more you. The Geriatric Society now recognizes the importance of checking B12 levels in all patients with cognitive complaints, regardless of age. It's a significant advance in brain health care, but unfortunately, many doctors still haven't incorporated this practice into their care routines. That's why I consider it so important to share this knowledge with you. Information is power, especially when we talk about health. You now have in your hands a powerful tool that can make all the difference in your journey of healthy aging. Of course, vitamin B12 is not a silver bullet. that will solve all problems related to brain aging. We need to remember that good cognitive health depends on multiple factors, including regular physical activity, quality sleep, stress control, constant mental stimulation, and obviously a balanced diet with all necessary nutrients, not just B12. But we can't ignore the fact that, for many people, correcting the deficiency of this vitamin can be the first transformative step to regain brain health. As we saw in the cases I shared, the results can be truly impressive. For those wondering about the relationship between B12 deficiency and vegetarians or vegans, it's important to mention that this group really has an increased risk of developing this deficiency, especially as they age. If you follow a plant-based diet, B12 supplementation is not optional. It's absolutely essential. There are excellent vegan supplement options currently available, and your doctor can help find the best one for your case. Did you already know about the importance of vitamin B12 for your brain? Had you already heard that a simple nutritional deficiency can cause symptoms so similar to those of dementia? This information can literally save lives, or at least the quality of them. So don't keep it just for yourself. Share it with your friends and family, especially those over 60 or who care for people in that age range. Remember, knowledge is power, especially when we talk about health. And now you have in your hands information that can make all the difference. Based on the most recent neurological studies, ensuring adequate levels of vitamin B12 can be the difference between healthy cognitive aging and the accelerated decline of the mind. Your brain is too precious to be neglected. It holds your dearest memories, your personality, your essence. Protecting it should be a priority. And now you know a simple but powerful way to do it. If this content was useful to you, don't forget to leave your like, share it with those you love, and subscribe to the channel for more valuable information about health and wellness. In the next video, I'll reveal 3 daily habits that, combined with adequate levels of B12, can literally rejuvenate your brain in 90 days. Your memory and your family deserve this care. Until the next video, this is Dr. Sophie Miller, always committed to your health and quality of life. Take good care of yourself and remember, small changes, big results.